One of my patients came to me last year complaining about fatigue and memory issues. Elderly woman sitting alone on a sofa looking exhausted, rubbing her forehead, tired expression, cinematic healthcare documentary style. She was exhausted all the time. She could not remember simple things. She felt like her body was slowly shutting down. Senior woman standing in kitchen looking confused, forgetting where she placed an item, worried facial expression. We ran every standard test. Blood work, thyroid panels, everything came back looking normal. Doctor reviewing laboratory reports and blood test results on a computer screen inside a clinic. Her previous doctors had told her for 2 years that it was just stress, just aging, just life after 65. But when she sat down in my office, I did something that most doctors do not do anymore. I looked at her hands. Close-up of elderly hands resting on a desk while a doctor carefully examines the fingernails. And the moment I saw her nails, those deep, prominent vertical ridges running from the base of her fingers all the way to the tip, I knew exactly what we had been missing. Extreme macro shot of fingernails with visible vertical ridges. She was 67 years old, and what those ridges revealed completely changed her diagnosis and her treatment. Within 3 months, she felt like a different person. Happy senior woman walking outdoors confidently and smiling. Now, I want you to do something right now. Hold up your own hands and look at your nails closely. Older adult raising hands and examining fingernails carefully. Do you see those lines? Those thin vertical ridges? Because if you are over 65 and you have them, this video may be one of the most important things you watch this year. My name is Dr. Emily Walker, and today I am going to tell you exactly what those ridges mean, why most doctors are not talking about this, and what you need to do about it starting today. Now, before I get into the science, let me paint you a picture. You are sitting at your kitchen table one morning, and you notice your nails look a little different than they did 10 years ago. Person sitting at breakfast table examining fingernails in morning sunlight. They feel slightly more brittle, maybe they break more easily, and those ridges have become more prominent. You mention it to a friend and they say, "Oh, that's just old age, honey." You mention it to your doctor at a busy appointment, and they give you a quick glance and say the same thing. So you accept it. You move on. But here is what I want you to understand. Just because something is common does not mean it is something you should ignore. And the research I am about to share with you proves exactly that. Let's start with what these ridges actually are. The medical term is onychorexis, and it describes longitudinal ridging of the nail plate. Medical animation showing nail structure and longitudinal ridges forming on the nail surface. Your nails are made of a protein called keratin, the same protein found in your hair and in the outer layer of your skin. Scientific animation showing keratin fibers inside hair, skin, and nails. Keratin cells are produced at the nail matrix, that little half-moon-shaped area at the base of your nail, and they push forward slowly, forming the nail plate as they go. In a perfectly healthy, well-nourished body, this process happens in a smooth, even way, creating a nail that looks glassy and uniform. But when that process gets disrupted, when the cells are not dividing evenly, when blood flow is inconsistent, when nutrients are running low, you get ridges. You get those lines. Split-screen comparison between healthy smooth nails and ridged nails. And after age 65, the reasons behind those disruptions become far more medically significant. Here's the first thing the ridges may be telling you, and this one surprises almost everyone I talk to. Vertical nail ridges in older adults are frequently associated with nutritional deficiencies, specifically deficiencies in iron, B12, and zinc. Now, you might be thinking, but Dr. Walker, I eat well. I take my vitamins. And that is exactly the problem that nobody talks about. After the age of 60, the human digestive system undergoes real, measurable changes. The stomach produces less hydrochloric acid. The small intestine absorbs nutrients less efficiently. A study published in the American Journal of Clinical Nutrition found that nearly 20% of adults over 60 are deficient in B12, not because they are not consuming it, but because their bodies have lost the ability to absorb it properly, and B12 is not just a nail vitamin. B12 deficiency affects your nervous system, your energy levels, your memory, and your heart function. So when your nails are showing those ridges, they may literally be sending up a signal that your body is running low on something it desperately needs. Now let's talk about something even more important, because this is where the conversation gets serious. Vertical ridges in people over 65 have also been linked to poor peripheral circulation. Your fingernails sit at the very end of your vascular map. They are the last destination that your blood reaches before it turns around. This means that if your circulation is even slightly compromised, and in people over 65 this is extremely common, your nail matrix is one of the first places where that shows up. Poor circulation to the nail matrix means uneven keratin production. Uneven keratin production means ridges. And here's the connection that should make you pay attention. The same circulatory insufficiency that creates those ridges can also be quietly affecting your brain, your kidneys, and your heart. A 2019 study in the Journal of the American Geriatric Society found that peripheral vascular signs, including nail changes, were significantly correlated with undiagnosed cardiovascular risk in adults over 65. Your nails are not just beauty accessories. They are, in a very real sense, a window into your vascular health. But wait, there is more. And this is the part that I think is the most overlooked by conventional medicine. Vertical nail ridges are also a known marker of chronic inflammation and autoimmune activity. Conditions like rheumatoid arthritis, lupus, and thyroid disorders frequently manifest in the nails before they are diagnosed anywhere else. The nail matrix is extraordinarily sensitive to systemic inflammation because it is a highly active tissue. It is constantly dividing, constantly producing new cells. When inflammatory cytokines, those chemical messengers of inflammation, flood the bloodstream, they disrupt the nail matrix's ability to produce smooth, even keratin. The result? Ridging, brittleness, changes in nail texture and color. A paper published in Clinical and Experimental Dermatology noted that nail abnormalities appeared in a significant portion of rheumatoid arthritis patients before joint symptoms became severe enough to seek medical attention. Think about that for a moment. Your nails were trying to tell the story first. Now I want to address something, because I know some of you are watching this and thinking, but Dr. Walker, my doctor told me it's just normal aging and there's nothing to worry about. And here is my honest answer. Mild, fine ridging can indeed be a completely benign part of aging. I am not here to scare you. But, and this is a critical but, the ridges that deserve attention are the ones that are deepening over time, the ones accompanied by nail brittleness, discoloration, or thinning, and the ones appearing alongside symptoms like fatigue, cold hands and feet, brain fog, or joint pain. If your ridges are prominent, getting worse, or paired with any of those symptoms, that is your body speaking to you in a language you now know how to read. So what do you actually do about this? Here is the practical part, because knowledge without action is just interesting trivia. First, I want you to ask your doctor, at your very next appointment, to run a complete blood panel that includes ferritin, B12, folate, zinc, thyroid function, and a basic metabolic panel. Not just a standard CBC. Be specific. These are the markers that will tell the real story behind your nails. Second, talk to your doctor about whether you need a B12 supplement in methylcobalamin form. This is the form that the body absorbs most effectively, especially in older adults. Third, if you are eating well but still showing signs of deficiency, ask about digestive enzyme support or whether a condition called low stomach acid, known medically as hypochlorhydria, might be affecting your absorption. This is far more common in people over 60 than most people realize. Fourth, and this applies to everyone watching, pay attention to your circulation. Daily gentle movement, even 20 to 30 minutes of walking, dramatically improves peripheral blood flow. Staying hydrated is equally critical because dehydration thickens the blood and reduces circulation to those tiny capillaries that feed your nail matrix. And if your hands and feet are frequently cold, if you notice blanching or discoloration in your fingers when you are in cold environments, please bring that up with your doctor because it may warrant a vascular assessment. Fifth, and this is the one I want to end on because it is the most empowering. Start looking at your nails regularly, not to admire your manicure, but as a genuine health check. Just like you check your blood pressure or step on the scale, take 30 seconds every few weeks and look at your nails. Are the ridges getting more pronounced? Are new symptoms appearing alongside them? Are your nails becoming more brittle or changing color? This kind of consistent self-monitoring catches changes early, and early is always better in medicine. Always. The human body is remarkably communicative. It does not suffer in silence. It sends signals, it leaves clues, it speaks through the skin, through the eyes, through the hair, and yes, Through the nails. After 65, those signals deserve more respect and more attention than they typically receive. The vertical ridges on your nails may be nothing, or they may be the opening sentence of a health story your doctor has not read yet. Either way, now you know what questions to ask. If this video gave you something new to think about, something that made you look at your hands in a different way, then please do me one favor. Hit that like button right now. It takes 1 second and it helps this channel reach the people who need this information most. And if you are not yet subscribed to this channel, please subscribe and turn on the bell notification, because every week I bring you science-backed health information that is specifically designed for people over 60. Practical, plain language, and always doctor-reviewed. And before you go, I want you to watch the next video on this channel because I am covering another nail sign that is even more commonly missed than vertical ridges, and the health condition it points to affects 1 in 3 adults over 65 without them knowing. You will not want to miss that one. Thank you so much for spending this time with me today. Take care of those hands, and take care of yourself.